Hello students, I'm Dr. Daniel. Tonight we're going to work a problem on the market of supply and demand, showing what happens in a market when you impose a price ceiling. So this is the market for organs for transplant, such as kidneys or livers or hearts, okay? And assume there is a market equilibrium price for the organs for transplant, and at that price there's an equilibrium quantity being exchanged. Suppose the government imposes a zero price ceiling on organ transplants so that you cannot buy an organ transplant in the United States, nor can you sell an organ. That is in fact what we have in this country, a zero price ceiling. So if the government imposes a price ceiling of zero, what happens in the market for organs? Well, at an equilibrium price way up here, this many people want an organ, so the quantity demanded is here. At a price of zero, the quantity demanded is much greater. The quantity demanded would increase to here. So the curves don't shift, but the price dropping causes the quantity demanded to increase. What happens to the demand for organs at a zero price ceiling? It doesn't change. The demand for organs is determined by whether or not you need an organ. Just because organs become cheaper doesn't mean that more people are suddenly anxious to have an organ transplant. You don't want an organ transplant if you don't need it to keep you alive. Okay, so changing the price does not change the number of people who would benefit from an organ transplant. It only changes the number of people who are willing to pay for one. And a price change is a movement along this demand curve, and a quantity change is a movement along this demand curve. When the government puts this supply curve, when the government puts a price ceiling on, this used to be the quantity supplied of organs for transplant because people could get paid for donating a kidney to a family member or donating an organ from someone who has died. And if you eliminate the ability to pay them, a lot fewer people are going to be willing to supply organs at the lower price. So the quantity supplied will drop, okay? So it used to be this many, and now it's this many. So imposing a zero price ceiling doesn't shift the curves. It simply changes the price and changes the quantity demanded and the quantity supplied. It doesn't shift any curve. So now at the new price of zero that the government imposes, there's a huge shortage of organs for transplant, and that in fact is the case. Why don't we have a market for organs? Well, that's a dilemma because of course, if you paid people to donate, you'd have more people being willing to donate. But you'd also have a very unpleasant incentive for people to kill other people to sell their organs. And that's a place that the government doesn't want to go. It's a very sticky wicket. So there's arguments on both sides. So changing setting a price ceiling just affects the price. It doesn't change the supply curve or the demand curve. Those are determined by other factors. Okay? So if there were some epidemic of heart disease that destroyed people's hearts and made it necessary for them to have heart transplants, that would increase the demand for transplants, okay? Or if we got some fabulous new treatment for heart disease that enabled people's hearts to work much longer, that would decrease the demand for transplants. So the actual supply of transplants and demand for transplants are not driven by the price. Those are reflected in movements along the curve. Good night.